Hello, my name is Joel Cook. I'm one of the nursing lecturers at North Metropolitan TAFE, and today I'm going to demonstrate the insertion of an indwelling catheter on a female patient. So firstly, we're going to go through the equipment that we will be using today. Now, very roughly, I have situated this from left to right, the order of use, very roughly. So we have our bluey here that we'll put underneath the patient. We have our bin bag, our catheter pack, which has its variety of instruments in it, our sterile sized gloves, our sterile lignocaine gel, a 10ml Luer-Lock syringe, a 10ml water for injection, a chlorhexidine wash, a 12 French IDC for a female, an indwelling catheter drainage bag with the drainage bag holder, and the catheter attachment device too. Other equipment you may need is a urine specimen cup in case you need to catch a urine specimen. We have some non-sterile gloves which we'll be using near the end of the procedure. And we also have here some other catheter bags which we won't be demonstrating today, but you may need to use in the clinical environment. And one is a leg bag, and one is an hourly drainage bag where you have much more accurate measurements hourly. Knock knock. Hi Josephine, how are you going? My name's Joel, I'm one of the nurses. How are you feeling? Okay. All right, can I just quickly check your name tag? Can you please tell me your full name and date of birth? Great. Perfect. 9654321. That's good. Okay. All right, so I've come in today, Josephine. As you may be well aware, the doctors have ordered for you to have an indwelling catheter inserted. Now, do you know what an indwelling catheter is? Okay, so an indwelling catheter is we insert a tube into your bladder that will drain the urine out of your bladder into a bag. With this procedure, shouldn't be too painful. We're going to use some local anesthetic gel that will numb it as much as possible. And after the procedure, you mostly won't even know that the catheter is there anymore. You need this because you have fractured your right hip, and so you will be immobile for at least a few days and following your procedure as well. And by putting this in, you won't need to get up and go to the toilet to urinate anymore. Is that okay? Do you have any questions? Okay. Now, before I go get the equipment, I do just want to check if there's any contaminant in the area. Is that all right if I do that now? Okay. Okay, Josephine, so it won't be long, just 2 seconds. Just need to have a quick look. Yeah, that's all good. All good, okay. Great, so I'll go get the equipment. And I may be back with another nurse who'll help me out with the procedure, and then we'll get underway. Overall, shouldn't be more than 15 minutes. Okay, thank you very much. Hi again, Josephine. I've just got all the equipment. I'm just going to set it up and then we'll begin, okay? Okay, so now I've returned to Josephine's room and I have all the equipment and we'll begin preparing it all. So I've got my catheter drainage bag holder that I put on the bedside, and my drainage bag, push that into there, and then into the tool holes on the side. Hang that up, and then we tuck this under here for attachment to the catheter tube later. Got my bin bag opened up, and I'm going to just put my sterile gloves there to open up a bit later. Now I have our catheter pack, which we're going to open up. Making sure the flaps are on top. To open up like a book. Making sure I don't touch any of the insides of this catheter pack. Now I need to get those towels out the way, so I'm going to grab them. It's the inside of this pack and put them aside, just like so. And because I need access to those two tubs. So in the tub, without any cotton balls, we put in the water for injection. The whole 10 mils. And in the tub with the cotton balls, we put in the chlorhexidine wash. Of course, making sure I'm squirting it in from a safe distance so I don't dirty my aseptic field. Opening up my lignocaine gel. My 10 ml Luolox syringe, which is going to be for the balloon. And finally, my 12 French catheter. Which hopefully opens nicely for me. There we are. Okay, so we're pretty much set up there for use once we have our aseptic gloves on. But for now, we need to go back to Josephine to put the bluey underneath her and position her for insertion. So I'm just going to get my non-sterile gloves on and grab my bluey. Hi Josephine, we're just about set up. I just need to position you for the insertion if that's okay. Great, I'm just going to pull these curtains. Okay, and I just need to raise your bed as well, if that's okay. That's about right, and now I need to lay you flat. Okay, thank you. Great. I'm just going to put this bluey underneath you. So I need this left leg to be raised and angled out like that. It's perfect. And we won't move your right leg, of course, because that's the one where we have the fracture. And I'm just going to place this bluey underneath there like that. Now make sure when you're putting this bluey in, you don't have any parts that maybe get in the way of your sterile field. Okay, I'm just going to go finish off preparation, Josephine, and we'll come back and insert that catheter, okay? Thank you. So now we get our sterile gloves. We open these up. We basically get them ready for us to put them on as soon as we have our good hand hygiene. So remember, this is a sterile procedure. So always do your non-dominant hand first. Okay, so right hand grabbing the outside, left hand palm up. And my right hand doesn't stop grabbing where it's grabbed and just pulls from there to get that on. Now my right hand grabs from the inside, and my left hand can grab from the, my left hand can now go inside here to help me get this glove on. And a bit of fiddling. And again, make sure my gloved hand doesn't touch my skin at all on my right arm. There we go. Now we can adjust freely, making sure we don't touch our skin with these gloves. So now I am donned with aseptic gloves. Now with these aseptic sterile gloves, I can touch my sterile field. So we can begin to get things ready here. So I'm going to, with my 10 ml syringe, draw up the 10 mils of water for injection. A bit more. That's it. And that's going to inflate the balloon in the catheter. And also open up my catheter. And put on half of the lignocaine gel on the distal 6 centimeters of the catheter, so from the site of insertion. So just half, so up to 5 mils. That's it, and the other 5 mils we're going to use on the urethra. Okay. And after that, we're pretty much ready to go. So now I can bring everything over to Josephine. Okay, Josephine, just going to put this drape over now, okay? So when we put this drape over, just be really careful that you and your sterile gloves don't touch any part of Josephine. That may make you unsterile. Now we're going to be putting equipment here in between Josephine's legs, so make sure you have a good place, make sure you pat that down so it's nice and stable for you to put things there. Okay. So we grab our cotton swabs with our forceps and we place that there and we begin cleaning Josephine. Now when my left hand touches Josephine's meatus, it cannot leave it. It needs to stay there until we get urine flow out of the catheter. So open up the labia, site, the urethra, and swab 5 times top to bottom. Okay, and then we can throw all of this out. Now we can get the rest of our lignocaine gel and insert it into the urethra and insert all 5 mils. Okay, Josephine, we're going to use the lignocaine gel. It might sting a little bit. Okay, in it goes. Great, all done, thank you. So now we wait 3 to 5 minutes for that lignocaine gel to work. Once 3 minutes have passed, we can now bring our kidney dish between Josephine's legs and get our catheter. Holding it roughly about 5 centimeters from the tip. And we put the back end into the kidney dish because urine is going to flow out into that kidney dish. And then we can begin insertion of the catheter. So, okay, Josephine, we're going to insert the catheter now. So take a deep breath in. That's it, and breathe out slowly. That's it. That's it, good work. Great. So we insert until we get urine flow and then 6 centimeters further. you may end up inserting to the bifurcation itself. So now we have urine flow. My hand can come off the meatus, and we insert the catheter, and we blow up our balloon with 10 mils of water for injection. So on this second port here. From here we gently tug on the catheter to make sure it's in situ until we get just a little bit of resistance, and then we know it's in the right place. Now here, if I wanted a urine sample, is where I could catch a urine sample. And I'll do this by getting my urine cup, opening it up, and just catching it into there. Okay, now we can attach our catheter bag. So this tube that I prepared there before, open that up and connect them together. And that is the majority of the procedure done. Well done, Carlotta. Just got to tidy up now, okay? So this will have urine in it. Carefully place it back here. Tear your drape and put that here. And then clean up any excess discharge or water, cleaning gel or cleaning or solution or gel from the area. And we can take this buoy off as well. Okay, almost there. I'll take those gloves off, perform hand hygiene, and the last thing we need to do is attach the catheter attachment device. And now we want this high up on the leg, because otherwise we would put it down too low. We put too much tension on the catheter itself. You can cause damage, so have it high up on the leg on the inner side of the thigh. Whatever kind of catheter attachment device you're using at your facility. Put that in there like that, and clip it over. Clean everything up. Okay, well done. I'll put this lead back down for you. Okay, all done, Josephine. Thank you very much. How are you feeling? Want to sit up a bit again? Okay. All right, well done. All finished. Let us know if you need anything else. Let us know if it begins to hurt. Needing to feel like you need to go to the toilet is quite normal, but don't worry, you don't need to go to the toilet now, okay? We don't need to go to the toilet to urinate anyway. Your procedure is tonight, so we'll let you know how that goes, but yeah, if you need anything, just press your buzzer, okay? Okay, thank you. Now that you have inserted the indwelling catheter, it is time for documentation. So firstly, we need to document into the progress notes, where we fill out the indwelling catheter insertion sticker with the appropriate details, adding a little note at the bottom whether it was inserted with or without incidents. We also need to document on the fluid balance chart, documenting there the amount of drainage we had from the catheter. And we also need to document on the care plan, in the elimination portion of the care plan, talking about the catheter, which is now in situ. When it comes to other considerations, we didn't cover everything in this video, so please access your resources or talk to your lecturers during lab. Thank you very much for watching.